Well, October is Breast Cancer Awareness Month. More than 230,000 new breast cancer cases among women are expected this year. More than 7,000 of those cases are here in North Carolina. Well, breast reconstruction surgery is a costly but life-changing procedure, and some women don't know their health insurance may cover some of the costs. Well, joining me now is Dr. Brian Coan, founder of Care Plastic Surgery in Durham and Chapel Hill, with more on what patients need to know. Good morning, Brian.
Good morning. Thank you for having me.
Yeah, thanks for joining us. This is a very interesting procedure here. Tell us, how much does insurance cover?
Well, actually, since a 1998 federal mandate, insurance carriers are actually required to cover breast reconstructive procedures for women.
Oh, I didn't know that. And that's across the board, all kinds of insurance.
Across the board, all types of insurance. Obviously, patients should seek out their doctors and talk to them about the reconstructive options that are available to them, and then discuss the deductibles and things with their plan.
Well, you talked about the different options. So are there exact procedures that insurance companies will cover?
There are a variety of procedures that are available, and we happen to live in a very fortunate part of the country. Some of the most complicated procedures are available to patients in the Triangle area. These are happening every day to patients all around. Additionally, Bev Perdue, our governor, has really been an advocate for breast cancer and awareness and treatment in the state. So we really have a lot to thank her for that.
Oh, yeah. Tell us about some of the options available to women. I see you brought some samples in.
Well, absolutely. Reconstructive options are available, and by far the most common procedure performed is a two-stage procedure using expanders and implants. The first step may be performed in the hospital at the same time that the breast is removed and the expander is placed. Subsequent procedures are performed in the office, where this expander is filled with saline, and when it reaches the appropriate size and shape, a secondary procedure, usually as an outpatient, is performed, and the patient has a formal silicone breast prosthesis placed that feels and looks a lot like her normal breast.
Right. And do you meet up with the patients afterwards? We know it's a life-changing procedure, so tell us about that. This
is an ongoing relationship between the doctor and the patient, and definitely getting to know your doctor is a very important part of that process. From start to finish, the physicians are available, and we all work as a team, from the surgical oncologist to the medical oncologist to, of course, your reconstructive surgeon. And I know many of my patients years after they've begun their process, and they are enjoying the results of their treatment.
Well, that says a lot about you, too. Dr. Brian Coan, thank you so much for your time.
Pleasure was mine. Thank you very much.
Thank you.